They're the backbone of the NHS, a workforce a third of a million strong, all striving to deliver high-quality healthcare in hospitals and communities across the UK. But nurses are being stretched, sometimes far too thinly, and it's taking its toll on them and their patients.
We've had shifts recently where we started off and we're 3 or 4 nurses short.
This nurse spoke to us anonymously, and we haven't used her real voice. She recalls how a woman died recently while her ward was busy and understaffed.
It's the feelings of kind of guilt that we didn't have enough time, enough people to be able to actually just sit there and hold her hand as she went.
But effectively she died without anyone really looking after her.
Yeah.
How did you feel after that?
Horrible. I went home and I cried. And it makes you not want to come back in the next day, but you will.
The UK-wide survey asked 30,000 nurses about their last shift. 55% reported fewer nurses were on shift than planned. 26% had 14 or more patients to look after. And even though 65% worked an unpaid extra hour that shift, 36% said essential patient care did not get done, like giving pain relief or completing medical records. The Department of Health says it's training an extra 10,000 nurses and other staff over the next 3 years. But the nursing union says what's needed is a law specifying the maximum number of patients a nurse can care for.
It should never be left to chance that we're going to have safe or effective care, that we're safe in our hospitals and in our communities. And we believe that for taxpayers, good quality nursing is a right when you're not well. And therefore we would ask for staffing levels to be legislated. We think it's time that now happened.
Patient surveys show satisfaction with nurses remains high, an indication perhaps of how much pressure they're soaking up.
You have a little moment, a little cry, and then you regroup and you come back out and you start again. We look after each other. You have to, or you'd never survive.